everyone. In today's video, I'm going to be talking more about the challenges or roadblocks that I have experienced navigating the mental health care system. So if you've been watching our channel for a while now, you will know that I have come up against a lot of challenges or roadblocks while navigating the mental health care system. And if you want to learn more about my story, you can watch my full story here. But in this video, I'm going to be talking about specifically the roadblocks that I experienced navigating the mental health care system. The challenges that I'm going to talk about today are by no means an exhaustive list of all the challenges that people come up against navigating the mental health care system. I'm very aware that I hold a lot of privilege, even as a mental health care patient. I am female, I'm young, I'm white, I come from a middle-class family socioeconomic background, I have university education. I was in university and had access to a lot of supports that people don't typically while I was in the process of first experiencing the onset of my illness and diagnosis process. I saw firsthand that these attributes, these characteristics of mine made me more palatable to the mental health care system and to medical professionals. And, in some ways, made people see me as a more deserving patient. I'm very aware that if I did not have these, attributes or characteristics attached to myself, that I probably wouldn't have gotten the same caliber or I wouldn't have had access to the same supports as I did. As much as I feel that I have faced a lot of challenges navigating the mental health care system, I know that I still hold a lot of privilege in my experience of it. I know that if I didn't have these characteristics that I just described, I would have had a lot harder of a time. And I know that there are a lot of people out there who do have much more challenges than I did navigating the mental health care system. So before I dive into the challenges, I would just want to take a quick minute to introduce myself if you're new to this channel. My name is Lauren. I live with schizoaffective disorder, and I make videos about what it's like to live with a schizophrenia spectrum illness. If you want to see more videos like this one, make sure to subscribe to our channel. Also, if you would like to help support us in creating this content, please check out the link to our Patreon page in the description below. Once you become a patron, you also gain access to our online peer support community where we offer peer support through various forms, including weekly peer support groups. So if this is of interest to you, or if you'd just like to help support the channel, please check out the link to our Patreon page. Also, I want to give a huge shout out and thank you to all of our patrons. You make making these videos possible. Thank you so much. All right, so starting at the beginning of my journey through the mental health care system, I think the first roadblock or challenge that I experienced was just a general lack of awareness about warning signs of mental illness. So I'm particularly talking about when I was in high school. I started to develop, signs that something was going wrong and signs that I was in the prodromal phase of schizophrenia, where I was really withdrawn. I was going through periods that looked like depression. And there was a lot of, warning signs coming up that no one really recognized or identified as warning signs that something was amiss with my mental health. And so it went largely unrecognized, and the early intervention period that is so crucial for people with schizophrenia spectrum illnesses kind of went unchecked. The next roadblock or challenge that I experienced was that I decided to go to my general practitioner, my family doctor, to, bring forward some of the concerns about the depression that I felt that I was experiencing in my late teen years. They prescribed me antidepressants, didn't really do much else, talk to me at all, really. They just prescribed me antidepressants, sent me on my way, and there was no efforts to make any sort of follow-up appointment or anything. And so I eventually just stopped taking the antidepressants because they weren't really working. I felt largely unsupported, and this was another chance for early intervention that went missed. Something else that was difficult around this time and kind of throughout my mental health care journey as well was that I had a general lack of social supports. Now, this isn't typically seen as the role of, medical care or the mental health care system, but I really believe in incorporating the social determinants of mental health into mental health care as well. And that kind of largely goes unrecognized as our current system stands. So I'm talking about things like employment, income, food security, housing, social inclusion, and things like this that really play a role in terms of a person's mental well-being that oftentimes go unaddressed. And so I didn't have a lot of social ties during this time. And this was kind of another way that I sort of fell through the cracks and my mental health deteriorated further. As I kind of progressed through the mental health care system and I became, connected with a therapist, a doctor, a psychiatrist, it still kind of seemed like they weren't addressing the chronic nature of the mental health challenges that I was experiencing. And a particular roadblock that I identified is that there is a really strong focus on crisis intervention in the current mental health care system. It really kind of neglects the chronic nature of difficulties and challenges that people who are experiencing mental health care difficulties face. It kind of seems like you only get access to care or the system takes you seriously if you are actively suicidal or if you make an attempt on your life. And that sort of, strong crisis intervention focus really kind of neglects a lot of people who maybe aren't yet at that point and kind of makes people have to reach that point before they get any sort of support or care. I have several videos that detail my experiences with hospitalization, but there were a lot of roadblocks and challenges present with my experiences with being hospitalized. And I don't think that I'm alone in this experience of leaving the hospital kind of more traumatized than when I entered it. This can be broken down into multiple points of contact within my hospital experience, beginning with being taken to the hospital by police in handcuffs, being restrained in the emergency room, tied down by my feet, hands, and chest, and forcibly injected. Abuse from staff that I detail more in some of our other videos if you're interested in learning more about that. But it really ultimately left me feeling more traumatized and less supported than before I entered the hospital. There also seems to be this kind of tunnel visioned focus on medication as the really only way to treat mental illness, particularly schizophrenia. I've been on countless medications, and that kind of seems to be the only thing that my treating psychiatrists have wanted to talk to me about. I want to bring it back to what I mentioned before about the social determinants of health and how there are so many more components beyond medication about, what it means to be mentally well and stable and to flourish. I have had really difficult experiences with medications. There are some really gnarly side effects from some of these medications. And I've been on injections, antipsychotic injections. And, a lot of issues come up around that. I've had a lot of anxiety and paranoia around medications. And the system hasn't really done a good job of working with me to, dissipate those anxieties and paranoia, but also to look at, well, how else can we work on your mental health beyond just medications? In terms of accessing care from my care team, there was also the added roadblock of stigma within the mental health care system. There's a lot of talk about stigma within society, about mental illness and whatnot. And I think we're making a lot of headway with more common mental illnesses like depression and anxiety. But there is even stigma that exists within the mental health care system, within care providers and whatnot, for some of the more serious or more stigmatized mental illnesses. I think it's probably a lot easier to go to your psychiatrist or your doctor and be like, yeah, I've been having some difficulties with my mood. I've been having low mood or whatnot. It's probably easier to go to them with that than to go to them saying like, yeah, I'm hearing voices. I'm seeing things that aren't there. I'm paranoid that police are following me. Those kinds of things are really difficult to, vocalize to someone else, even a care provider, a mental health care provider. There's still a degree of stigma that kind of provides a barrier between being able to be as open as possible in order to obtain the best care. That stigma that exists even with your care providers was another barrier that kind of prevented me from being as open and honest as I perhaps should have been or would have liked to have been with my care team. And keeping this theme of working with a care team going, it was also difficult to access care a lot of times. As I mentioned, I was very, very fortunate that I started to, really struggle with my symptoms while I was in university. And I had the tremendous privilege of having access to a care team consisting of a counselor, a GP, and a psychiatrist, all for free. And they kind of saw me as frequently as I needed. I was so lucky, but I was not prepared for when I graduated from university and went out into the general mental health care system. It was so difficult to be able to see even a general practitioner, a family doctor, let alone a psychiatrist. It was very difficult to have any sort of affordable therapy. Most therapy, where I live anyway, you have to pay out of pocket for. Eventually, I became connected with subsidized therapy and a psychiatrist after I was hospitalized, which was nice. But even then, there were limitations in terms of how many times in a year I could be seen, or how many times at all I could be seen by a psychiatrist. And it was really difficult to get a foot in the door in terms of being a patient in the mental health care system. And so if it is so difficult for people to even access care, no wonder a lot of people fall through the cracks. I mentioned being connected with community care following a discharge of a hospitalization, but this was the only time that I was ever connected with community care. My other hospitalizations, I was basically discharged and there was no contact with any community organizations or a care team outside of the hospital. And I think that this is a really, kind of gaping hole in terms of continuity of care for people moving through the healthcare system and moving from hopefully hospitalization to community care, or even from community care to hospitalization. There doesn't seem to be a lot of continuity or communication at all between different care providers or care services. And then another roadblock actually presented itself when I was doing well or when I was having periods of stability. The care system kind of seemed to just forget about me and just deemed me, oh, we're done. We're done with her. We don't need to support her anymore because she's stable. But that kind of misses the chronic nature of an illness like schizoaffective disorder or schizophrenia or, kind of any mental illness. I think that again is kind of putting the focus on crisis intervention as opposed to, having a mental health care system that encourages and supports wellness and, overall recovery. Another roadblock that I faced, I think is a really common one for people with schizophrenia, and that is around anosognosia. Now, I talk more about what exactly anosognosia is in this video here if you want to check that out. But basically, it's when a patient, generally with schizophrenia, has a lack of insight or doesn't understand that they have schizophrenia or that they have a mental illness. This was hard to navigate, and I think that the mental health care system could do a better job of addressing this in patients and working through anosognosia with patients. They can do this through better education for patients, taking the time to really talk things through more with the patient and provide better patient education about the illness that they're living with. I had a really actually good experience of this with a particular nurse therapist that I was seeing who really, went above and beyond and I think took more time than the care system allotted her to do, which I was tremendously grateful for, to really provide education for me about my illness, to talk with me about what it means to live with my illness, to talk with me about, gaining insight into my experience of living with the illness. And she did a really wonderful job of addressing this and kind of addressing this roadblock. Now, this is not at all a standard of care currently offered in the mental health care system. For people who don't have a therapist who goes above and beyond like this, when they're experiencing anosognosia, you basically forget or don't understand that you have an illness. And so it's very easy to just fall out of the system or to just step out of the system and kind of be forgotten about, and then ultimately end up likely relapsing. Another roadblock I experienced came in the form of misdiagnoses. So again, I talk more about my journey through different diagnoses in my story video, but basically I was first diagnosed with depression from someone, and then I was diagnosed with bipolar, and then bipolar with psychotic features, and then finally schizoaffective disorder. And I think that the fractured nature of our mental health care system kind of led to this, discongruency between the care that I was accessing at different periods in my life. And I think if there was more communication and better cohesion within the mental health care system and within various access points that people access the mental health care system, I think that this probably would have been mitigated or improved upon, and I would have gotten a correct diagnosis earlier. And touching on the various access points that people experience, I think there's also the roadblock that our current care system has a lot of different access points. And basically, the way it's structured right now, it largely relies upon the competency of the individuals at those various access points. And I think that that's honestly putting too much pressure on those individual professionals, because that provides a lot of room for people to fall through the cracks if that person is incompetent in any way, or if they make any sort of mistakes or direct people to the wrong services. It creates a lot of opportunities for people to fall through the cracks of the system. I think that maybe some ways to address this would be, better training and more accountability of professionals throughout the system, but also working to streamline the system in some way to reduce the opportunity for people to fall through the holes at all these different access points, and trying to figure out how to streamline services so that everyone kind of moves through, not in the same way, because everyone's experience with mental illness is going to be different and they're going to need different services at different times, but streamlining it in a way that makes more sense and people kind of know where to direct people a little bit better. I think another big roadblock that I faced is kind of the lack of patient-centered care within our current mental health care system. A lot of the times, care providers have certain goals or visions in mind of where they want their patient to get to, and those don't always align with the patient's goals and visions of where they want to be. And I think that we need to kind of reshape the mental health care system to put the focus more on what the patient wants and to work on identifying what their goals are in terms of reaching a point of wellness for themselves and how they define what wellness is, as opposed to focusing more on what the provider defines as wellness. I think that in a way, this actually leads to another roadblock that I experienced, which is just kind of generally a distrust of the medical system. I think that kind of all of these roadblocks that I've talked about already have kind of led up to me having a bit of a distrust of medical professionals and of the healthcare system, because there's so many gaping holes in it. One of my core delusions, and I don't even know if it should be called a delusion because I think there's some merit to it, is that, I can't trust medical professionals in the mental health care system, or I can't trust establishments in the mental health care system. I have a lot of kind of valid reasons that build a foundation for this mistrust. And the final roadblock that I want to talk about today that I experienced is the power imbalance that exists between care providers, particularly psychiatrists, and the patient. As it currently stands, kind of all or the bulk of the power lies with the care provider, and especially psychiatrists. And it's kind of the patient's job to just take what the psychiatrist tells them or take what the care provider tells them and do it. There's even words that float around so often in the mental health care system, like compliant or non-compliant. And, patients actually get labeled like this. And I think that this is doing such a disservice to patients, because I think that the power ultimately should lie in their hands to direct their own care and to have a sense of empowerment over their own journey through the mental health care system and their own journey towards recovery and what that means for themselves. I think so often patients are left feeling really powerless because of this power dichotomy that exists. I know I have felt extremely powerless at various points throughout my mental health care journey, even to the point where I tried to advocate for myself at various points. But one that I'm thinking about in particular was that I was up against or in front of a panel of doctors when I was trying to leave the hospital one time. I felt that the hospital was not serving me. I felt I was not getting better there. And I felt that I would ultimately be better equipped to work towards a place of wellness outside of the hospital. But I wasn't given that power to, even though I was clearly communicating that, I wasn't given the power or ownership to make that kind of decision. And ultimately, they decided for me that I was to be kept in the hospital. And that kind of example of, being kind of talked down to by the medical care system and not having your desires respected is kind of, the power imbalance that I'm talking about a little bit. And like I said, I think there needs to be a really big shift or reframe in terms of empowering patients to take the helm of their own healthcare journey. So those are the main roadblocks or challenges that I wanted to share about my own personal journey going through the mental health care system. I am very aware that I am so, so lucky and I still hold a lot of privilege that I talked about at the beginning of the video. And I know that there are so, so many other people who fall through the many, many, many cracks that exist within the mental health care system and ultimately end up not being able to access the care that they really need. So thank you so much for sticking with me through that long list of challenges and roadblocks that I've experienced in my own journey. If you have similar experiences or if you have other experiences that you want to share, I would love to hear about them in the comments below. Also, just a quick reminder that if you want to see more videos from us, make sure to subscribe. And also, if you would like to help support the creation of these videos, to please check out the link to our Patreon page. Thank you so much for watching, and as always, wishing you and your loved ones good health. We'll see you in the next video. Bye.